Hi, my name is Megan Moore, Project Coordinator for Partnerships for Health Drug-Free Task Force.
Hi, my name is Erin Cohen, and I'm a coalition member with the Partnership for Health Drug-Free Task Force.
The Drug-Free Task Force was established in 2019 and is located in Hunterdon County, New Jersey. Hunterdon County is a suburban community with unique downtowns, agricultural beauty, and outdoor adventure. According to the 2010 census, Hunterdon County had a population of 124,000 people with 86% Caucasian, 6% Hispanic, 4% Asian, 3% African American, and 1% other. The median household income in 2010 was $100,000 per year. A 2020 Save the Children report ranked Hunterdon County as the safest place in America to raise a child. The strong school system and beautiful location brings many families to Hunterdon County. However, the proximity of Hunterdon County to the Port of Newark and Newark International Airport has brought drug trafficking to our beautiful and safe community. Route 78 connects Newark International Airport to Pennsylvania and runs through the northern part of the county. Exit 17 of Route 78 provides easy access to the McDonald's in Clinton, where many drug arrests have been made.
Our experience at the NCA was like no other. Due to COVID-19, the world was thrown into virtual school and work. We were disappointed the Academy would not be in person. However, our trainers did an amazing job making the NCA in a virtual world engaging, fun, and educational. We bonded and formed relationships with other coalitions in Zoom breakout rooms. We were unable to meet and have lunch with other coalitions. However, we were able to dress up on some days and play games during our lunch hour. In the end, being the first and hopefully the last virtual class, it made the NCA experience much more meaningful to us. It taught us the importance of flexibility and adaptability, which is essential in this ever-changing world of prevention.
The 3 weeks at the Academy gave us the tools and resources to look critically at the work we are doing and the work that still needs to be done. Prior to the Academy, we had some of the tools, but they were not being utilized as working documents. The best way we can describe our experience at the Academy is to compare it to a puzzle. We knew there are many pieces to building a successful coalition, but it was not until the Academy that we saw how each piece was so critical and imperative to complete the puzzle. These working tools guide the principles of how we operate. Building our community assessment helped us take a critical look at our county. We identified our strengths and our weaknesses. The community assessment is the first step to create a logic model. We identified the problem, root causes, and our local conditions. Our community assessment drives the work that we are doing as a coalition.
The development of the logic model was the most challenging product we worked on for the NCA. Coalition member Peggy Dowd, the director of One Voice, a faith-based coalition, has a lot of expertise in the development of logic models.
Using the Strategic Prevention Framework model, we were able to develop and assist in creating the logic model, which is a living, working document planning tool. The logic model is also a great visual to have at coalition meetings so that we can all stay focused on our strategies.
When thinking of incorporating our strategic and action plan in the coalition, it's imperative we remember our vision and mission statements. These statements guide us in all that we do. The Drug-Free Task Force empowers youth, families, and communities in Hunterdon County to make positive changes to live long, safe, and healthy lives.
The Drug-Free Task Force engages and empowers youth to make healthy decisions to prevent substance use and other dangerous behaviors through outreach, education, and partnerships with key stakeholders within the community. We have outlined SMART objectives our coalition intends to achieve based on the data from our logic model. We have identified short, intermediate, and long-term goals based on our problem statement, root causes, and local conditions. The strategic planning is what should be done, and the action planning is how it will get done. In order to change our local conditions, we have set in place the 7 strategies for community change. We have outlined activities for each of the strategies, who is responsible for completing the activity, and when it will be done. Our coalition has been busy at work since completing the NCA, implementing a variety of strategies. We are also reviewing our strategic and action plan quarterly in order to make changes based on current trends. The Evaluation Communication Plan is a great tool we are now using in our coalition. It's a great visual to keep us on task with identifying specific audiences and how our coalition benefits them as well as the action items we need from them. Because everything we do in our coalition is data-driven, the table provides a clear picture of the data needed for that specific audience and how we will present it to them.
Using the evaluation plan, the coalition ensures people have the right information. The evaluation plan allows coalition members to look at baseline data retrieved from the logic model, and also the frequency the data is collected and what tool the data is collected with. Incorporating this document into our coalition work helps us see the way in which the coalition has contributed to the change. The evaluation plan also helps guide strategies of the coalition as well as informs our work groups of the strategies needed to be adjusted.
Critical aspects in our sustainability plan are not only looking at sustainable funding, but also creating strategies that are continuous. For example, now that recreational marijuana has passed in New Jersey, we need to use the partnership with the schools we have created to change the marijuana curriculum. This collaborative approach will create a long-lasting change, even when our funding is gone.
Capacity is an important step of the SPIF model. After learning in the Academy about targeted recruitment and engagement, we realized that getting the right person to the right meeting at the right time is crucial. With the prospect of recreational marijuana becoming legalized in New Jersey during the November election, we recruited Allison Roberts, the chairperson for the Bar Association Cannabis Committee of Hunterdon County. Her knowledge and insight helped our coalition identify potential ramifications of legalized marijuana. Implementation is another key step of the SPIF model. Allison's insight allowed the coalition to then create a social media campaign aimed at informing and educating the community of marijuana legalization. Leslie Gable, the project director for the Drug-Free Task Force, gave us valuable insight on sustainability.
One of the things that we know about the Strategic Prevention Framework model is that ensuring that it's part of the operation of our coalition. Every meeting, every part of what we do has to ensure that we follow the process for success. One of the things that's very important is looking at our sustainable outcomes and ensuring that that's part of the Strategic Prevention Framework model from the start. This also includes diverse funding, policies, and collaboration of resources.
Building cultural competency within our coalition helps us target youth who are at an increased risk for substance misuse. Prior to the pandemic, our coalition began engaging with the Pulse Club, an LGBTQ+ student organization at Hunterdon Central Regional High School. Also this summer, at CADCA's Mid-Year Training Institute, I attended Hudson Pride's presentation entitled Pride and Prevention, Raising Community Awareness of LGBTQ+ Youth and Substance Abuse. This presentation was so impactful that we asked Hudson Pride to present at our annual Fall Professional Conference.
The biggest success or aha moment that will help improve the operation of our coalition work is how we utilize the tools. We are now using the tools in our day-to-day operation of the coalition. The tools guide the principles of how we operate. They will be reviewed and updated as needed to keep focused on data-driven decisions. We continue to grow with understanding the importance of sustainable change. The Drug-Free Task Force partnered with Positive Youth with the Help app. We printed cards with the QR code and information about the app to hand out to patients, but this is not sustainable. We will work with the local pediatricians' offices to post signs and to put it on their website in order to create lasting change.
Our Academy gave us the insight into the work we're doing and what work needs to be done. Our members include people in Hunterdon County in positions of leadership. We realized that we were not taking full advantage of their insight, connections, and expertise. At a Drug-Free Task Force meeting, we asked the members to divide themselves into two work groups, one for underage drinking and the other for marijuana. Within the groups, they were asked to identify what issues they see in Hunterdon County and any steps that can be taken. The marijuana group discussed the potential effects of legalization of marijuana in New Jersey. The participants were able to offer their unique perspective on the legalization of marijuana. The group decided on the next actionable steps based on the outcome of the election. On November 3rd, New Jersey passed a referendum to legalize marijuana. At the next meeting, the work group will discuss the next steps that will be taken to increase the awareness and dangers of marijuana and how communities will implement legalization. Our 3 weeks at the National Coalition Academy was both challenging and rewarding. It gave us the tools and the confidence that we need to be successful in the world of prevention.
A huge thank you to Angela DeRay and Christina Clark, our trainers, and Kim Linkle, our coach, for guiding and coaching us. We can't wait for the day we can see you in person.